on PACast later this afternoon. Today, our meeting is hosted by Department of Education Deputy Secretary Matt Stem and the Department of Health COVID-19 Response Director, Dr. Wendy Braund, to discuss updated school and summer camp guidance and recommendations in Pennsylvania. After our speakers are finished, we will be calling on reporters in the order of RSVPs, and we'll be taking one question for each reporter to allow as many reporters as possible. With that being said, I will turn it over to Dr. Braund.
Good afternoon, and thank you for joining us today. My name is Dr. Wendy Braund, and I am the COVID-19 Response Director for the Commonwealth of Pennsylvania. The Department of Health, working with the Department of Education, has been continuously working to develop guidance for schools. Our latest guidance, as released earlier today, updates our guidance for both schools and summer camps. The updated summer camp guidance is largely unchanged from what was issued last July. One of the primary updates of our guidance is that the Commonwealth, aligning with new guidance from the Centers for Disease Control and Prevention, states that students must now be at least 3 feet apart in classrooms instead of the 6 feet it was previously. However, in counties where substantial transmission continues to occur, middle and high school students should be 6 feet apart unless cohorting is possible. There are also additional areas where 6 feet of social distancing should be maintained. These include between adults in the building and between adults and students, when masks can't be worn, such as when eating, and during activities where increased exhalation occurs, such as singing, shouting, band, sports, or other physical activity. These activities should occur outdoors or in large, well-ventilated spaces. And the last is in common areas, such as school lobbies and auditoriums. In addition to these updates to our guidance, we also worked to release updated guidance on how schools should handle confirmed cases of COVID-19 in schools. The recommendations consider the amount of community transmission in each county, the number of cases among students and staff in each school building during the past 14 days, and the size of the school building. One example of the updates to this guidance is in regard to closures. In some instances, the recommendations for closures for in-person learning may be reduced to 1 to 2 days for a school, a change from the previous 3 to 7 days, and may be reduced to 5 days for a school, a change from the previous 14 days. These closures, while of a shorter time frame, still allow for necessary cleaning and for public health staff to direct close contacts into quarantining. It is essential for us to remember that if cases are at a level in a school that requires the building to close, the school must suspend all in-person instruction and extracurriculars, including school sports, in that building. This allows public health staff the necessary time to complete case investigations and contact tracing, and to provide the school with public health advice, such as information on cleaning and disinfecting. These updated recommendations to schools are on the Department of Education's website. This updated guidance continues to assist our schools as they work to be open for in-person learning. We must remember that the vaccine is our path to a new tomorrow. For all teachers who have not already been vaccinated, we want you to be vaccinated as soon as possible. However, the importance of having kids in school highlights the need for all Pennsylvanians to get vaccinated as soon as they are eligible. The COVID-19 vaccine is safe, it is effective, and we want each person who can receive it to do so as soon as possible. We are continuing to work to increase our allocations from the federal government and to route those allocations to providers who can quickly administer the vaccine to ensure we are vaccinating Pennsylvanians as quickly as possible. As we have started to see a slight increase in COVID-19 cases and hospitalizations across the state, there has also been increasing numbers of variant cases. Everyone must continue to be vigilant. We need all Pennsylvanians to continue to work together to combat the virus. Take advantage of the testing resources we have available. If you have symptoms consistent with COVID-19, we have testing resources available for you to get tested close to home. continue to wear a mask, even if vaccinated, while out in public, as we work to protect those who have not yet received the vaccine. Continue to social distance when out in public. And each of us must continue to wash our hands and take steps to protect one another. I, myself, and my colleague here today thank each individual for the efforts they are taking to protect themselves, their community, and to keep our kids in school. Thank you. And now I will turn it over to my colleague, Deputy Secretary STEM from the Department of Education.
Good afternoon. Thank you, Dr. Braun, for inviting me to join you today to share this important new information. My name is Matthew Stem, and I'm the Deputy Secretary for the Office of Elementary and Secondary Education at the Pennsylvania Department of Education. We at the Department of Education are committed to doing all we can to create the conditions for students to return to in-person instruction as soon as possible and as safely as possible. Throughout the pandemic, we've continued to monitor evolving research and guidance and modify our operational strategies accordingly. Along those lines, recently, the Centers for Disease Control and Prevention updated their K-12 recommendations to reflect 3 feet of physical distancing between students in classrooms where mask use is universal and other prevention measures are taken. We are pleased to work with the Department of Health in incorporating those changes into our guidance for schools while continuing to stay vigilant around mitigation strategies. We recognize the critical importance of in-person instruction and hope that this step, along with updates to our recommendations for responding to positive COVID-19 cases, will foster greater flexibility for school communities as they serve students each day. Ensuring student success and well-being is the highest priority for the Department of Education and for our schools throughout the Commonwealth, and we look forward to continuing to support our school leaders as we move forward together. So with that, we'll now open it up for any questions.
Thank you so much. First up today, we have Sam Zern from the PLS Reporter. Sam, I'm going to give you a request to unmute.
Hi there. This is a question for Deputy Secretary STEM. So about 2 weeks ago at a Senate budget education hearing, you mentioned a data system that PD had built for school districts to, input their local metrics. Is that data system going to be public? And have you noticed any trends in learning loss or growth or anything like that?
Sure. Thank you for the question. I'll speak to it very briefly, again, knowing that I want to make sure that we have ample time for the health and safety questions related to today's updates. But the work around the data system is moving forward. And at this point, we have not begun to import any of that information into the system yet. We are just pushing that information and those opportunities out to our school leaders. So we'd be happy to report back and share updates in the future as that moves forward.
Thank you, Sam. Next up, we have John Finnerty at CNHI. John, you may now unmute.
That's okay. I don't have any questions. I'll pass this time.
Thanks, John. Next up, we have Justine Gates at WTAJ. Justine, you may now unmute.
Hello, how are you?
Great, thank you.
With these new changes with the 3 feet apart instead of 6 feet, we have a lot more schools that are opening up if they weren't already. The bigger thing here for us is the difference in the amount of closures and the days recommendations. Is there a tool that these schools can use, or do they just report to the Department of Health and then they await guidance from there whenever they do find these cases within their school districts?
Dr. Braun, would you like to take that question?
Certainly. Thank you for that question. Yes, there are updated recommendations in the form of charts for schools broken down in categories of small, medium, and large by range of the number of occupants in the buildings. And those charts lay out the number of cases that plays into the number of closure days for schools that are in low, moderate, and substantial range of COVID cases and percent positivity. And we would work directly with you, or if your school district is in a jurisdiction with a local health department, then your local health department would work directly with you on the specifics around the case investigation and contact tracing, and recommendations on other public health actions you should take.
Thank you. Next up, we have Mike Buffer at the Citizens Voice. Mike, I'm going to send you a request to unmute momentarily.
Hello? Can you hear me?
Yes, we can hear you.
Okay. Are there any changes regarding the recommendations based on the incidence rate and whether the rate is in the substantial range? In our county here in Luzerne, we went out of substantial, now we're back in substantial, but none of the schools have changed in response to that going back into substantial.
Yes, thank you for that question. So as always, we are monitoring and reviewing all of the guidance that we have posted in the health and safety space. And so that would certainly include instructional model guidance. We have not made any changes to the model that you're speaking of for the recommendations under substantial, moderate, and low. But that's not to say that as conditions warrant that we would certainly consider any of those changes in the days and weeks ahead accordingly.
Thank you, Mike. Next up, we have Daveen at the Beaver County Times. Daveen, you may now unmute.
Hi, thank you so much for the time. I know, Dr. Brown, you mentioned a little bit more about vaccinations for teachers and such. How are we moving forward with seeing a higher level of vaccine distribution in our counties? You know, I look at the percentages of people who are being vaccinated. It's very unequal, you know, ranging from 40% in Montour to just 13-14% in Beaver and Monroe. And I imagine that also includes teachers. How are we approaching vaccine hesitancy with teachers, and how are we approaching getting the community to be more equally vaccinated? Because obviously that's a role in trying to keep COVID out of our schools and getting kids in person.
So this is a great question. The federal government has been extensively sending vaccine directly to our federal pharmacy partners, and so there are, and that is separate from the state allocation. And so there is an ever increasing number of pharmacy options, including pharmacies and grocery stores, for teachers and all other eligible folks to become vaccinated. We also, in terms of our state allocation, have made some changes to optimize our provider network to focus on high volume providers across the state to get folks vaccinated just as quickly as we can, as well as you know, paying attention to our equity initiatives to make sure that folks in disproportionately affected communities you know, are getting vaccinated. And education is absolutely critical in terms of addressing vaccine hesitancy. We are developing a communications plan around that. We will be holding town halls, and most importantly, we will be partnering with community leaders who are trusted voices in you know, at the community level to discuss vaccine hesitancy. Because as I said earlier, all of the vaccines are safe and effective, and it is important for people to get the first vaccine available to them when they are eligible.
Thank you. Next up, I'm going to read a question on behalf of PBS 39. Their question is, are there plans to update guidance as it relates to case thresholds, the number of COVID cases in a school that would require a building to close?
Yes, those guidance excuse me, that guidance has been updated, and that is what I was speaking to earlier, that the number of cases that triggers a school closure has been decreased relative to the previous guidance. And so that guidance is available.
Thank you. Next up, we have Ivy from Penn Live. Ivy, you may now unmute.
Hi, can you hear me? This is Evie from Penn Live. The press release mentioned guidance on summer camp programs. I don't think you have mentioned, either one of you has mentioned summer camps. Has anything changed with regards to, is the guidance the same as the school guidance?
The summer camp guidance is essentially the same as it was for last summer.
Can you reiterate that for the record?
Let me just see if I can grab it here handy.
Dr. Braun, if it helps, I think I can provide a little bit of information here if you'd like.
I'm sure that would be great. Thank you.
Sure. So in general, the summer camp guidance doubles down on the importance of health and safety plans being in place at in our summer camp type programs. And it also talks about the importance of following all of the mitigation strategies listed in the CDC's suggestions for youth and summer camps. So most of those recommendations are very similar to last year, and it again underscores the importance of following mitigation strategies and ensuring that whatever group size limitations are in place are also being followed at that time.
Thank you. We also added the press release in the chat function for your awareness. Next up, we have Boris at the Scranton Times-Tribune. Boris, you may now unmute.
Yeah, is there any difference between any difference at all between what the CDC has recommended and what the state is adopting? It sounded like there might be when it came to the 6-foot guidance in certain instances.
No, the state's guidance, it comports exactly with the CDC guidance as to when it is necessary to remain 6 feet apart versus the new 3 feet recommendation.
Thank you, Boris. Next up, we have Joshua Byers at the Tribune Democrat. Josh, we'll give you a request to unmute.
Thanks. I don't have anything right now.
Thanks, Josh. Next up, we have Tom Lehman at WGAL. Tom, I'm going to give you a request to unmute.
Wendy, can you talk a little bit about with regards to the difference between 3 feet and 6 feet? I know there's going to be people who probably don't really understand a lot about social distancing who might be asking why have that difference between adults and kids. And then I'm also wondering if you can talk a little bit about where things stand with vaccinations for teachers as far as percentage and progress.
Certainly. So the change in the distance is based on real world evidence in studies, data, excuse me, that have been analyzed in actual school situations that demonstrate that when schools are rigorously following all the other prevention measures, so masking, good hand hygiene, cleaning up of surfaces, etc., that the level of transmission is not substantially different at a 3-foot distance between children versus 6 feet. We know that child-to-child transmission is relatively rare, and that transmission in schools is most often among the adults. and adult to child. Hence the recommendations that adults remain 6 feet apart and that adults remain 6 feet from children. So I hope that it addresses your first question. To the Teacher and Childcare Worker Initiative, we have administered 112,172 teacher vaccines as of 3/22. So that is the most recent update that I have. My understanding is that we will be completing that initiative. We hope to complete that initiative this week.
Great, thank you. Next up, we have Andrew Goldstein at the Post-Gazette. Andrew, I will give you a request to unmute.
Hi there. I don't have any questions right now. Thank you very much.
All right, thank you very much. Next up, we have Samantha at the Daily Review. Samantha, I'm going to give you a request to unmute.
Hi, thank you for doing this today. I don't think I have any questions at this time, but thank you.
All right, thank you. Next up, we have Tim at One United Lancaster. Tim, you may now unmute.
Yeah, thanks for taking my question. I know that these are recommendations rather than mandates. I'm curious if the state has any information on which districts are complying, which districts are not complying, and if there's any information on differential case rates as a result of compliance or lack of compliance.
Sure, I'm happy to take that. If I may, I think I had a connection issue on my end where you stuttered there. Can I get you just to repeat a portion of that relative to the compliance? I only caught about half of that because of my network connection.
Sorry, let's try again. So I think there's some variance in districts complying with these recommendations. Does the state have data on which districts are complying and which aren't? And does the state have any sense of how well compliance is doing in terms of keeping cases down? Districts complying, fewer cases, districts not complying, more cases.
Okay, thank you. Understand the question. So a few things in the space. When it comes to compliance with the recommendations from the state, first want to really commend our school leaders for overwhelmingly doing everything they can, the majority of our school leaders throughout the state in complying with the orders. So, for example, the face covering order, which is certainly a requirement in the state. When it comes to recommendations and guidance, districts have the latitude along with their school boards and others to make decisions that consider our recommendations in light of local conditions. We do have a complaint process that's established whenever there is a sense that a district is not following or not complying with either recommendations or any of the orders that have come through the Department of Health. And we have a team that follows up on those complaints accordingly. And so, again, as we move forward, though, really want to commend the majority of our districts who have worked hard to comply with, with the systems that we have in place. Additionally, if I may, and this is, Tim, I apologize for doing this on your question. If I can go back, earlier there was a question around thresholds as it relates to the recommendations for responding to positive cases in schools. And just to clarify for those on the call, there are minimal, if any, changes to the thresholds that would trigger a school building closure, but the changes are most notable on the days that a school would remain closed. So I just want to make sure we made that clear here today.
Thank you. Up next, we have Kenny Cooper at WHYY. Kenny, you may now unmute.
Hello, I don't have any questions right now, so thank you.
All right, thank you. Next up, we have Pat Crossley at the Williamsport Sun Gazette. Pat, you may now unmute on your end.
No question at this time. Thank you.
All right, of course. And we have Cassie Miller at the Capital Star. Cassie, I'm going to give you a request to unmute.
Hey, Maggie, thank you for taking my question. I just wanted to follow up. Dr. Braun had said 112,172 teachers. Is that across the state for getting the Johnson & Johnson vaccine? I just want to clarify that.
Sorry, I almost forgot to unmute. Yes, and that statistic was current as of the 23rd of the month. Or 22nd, excuse me. I do not have the most updated figures at my fingertips, but I'm consulting with my comms folks, and we can certainly get you that information.
Absolutely. And we will pass it over to Maddie Hanna at the Inquirer. Maddie, you may now unmute.
Hi, thanks. I just wanted to ask about any data the state might have related to numbers of cases in schools or numbers of transmissions in schools. I know that the Department of Health has been releasing data based on age of cases, but I just wanted to clarify whether the state is tracking at all, you know, how many instances of transmission in school or at school events there have been, and if not, why the state has decided not to track the data in that way.
So the state reports cases among school-age children, ages 5 to 19. We do not report cases by school. Many districts do report those information themselves. We decided that to report by school-age children because of the complexities related to determining whether it is actually a school-based case. So that's why we just report them at the state level in terms of school-age children.
Great, thank you. Next up, as time permits, we have Hannah Brant, ABC 27. Hannah, you may now unmute.
Hi, yeah, thanks for taking my question. So the press release mentioned some funding going to schools to help them reopen. Is there any discussion being had about tying this to reopening plans? And are there any suggestions being made to schools about what to do with the funding that they're receiving?
Thank you for the question. Yes, schools have received federal funding. Most of that is through ESSER funding that comes federally. Most recently, there's now been another round of ARP ESSER funding, and schools are to be using those funds for a variety of activities to mitigate the impacts of COVID in schools, both academically and socially, emotionally, and from a public health standpoint. 20% of the funds that districts utilize must be used to address learning loss. And additionally, districts are going to be required to publish plans locally to as part of receiving those federal funds. So our team is working closely with other partners and districts. We've released some guidance, but we're going to continue to release guidance for schools to help them leverage those funds in thoughtful ways, particularly because many of these funds will extend out 2-3 years from today, even 4 years, with some funds going all the way through September of 2024.
All right, great. And I think we can squeeze just one last question in here. So if Tegan from the Tribune Review is on, we will give you a request to unmute.
Hi, I don't have any questions. Thank you.
All right, so I think that brings us to our conclusion. We will have a recording of this available on pacast.com. Thank you all very much for joining.